Ravichandran.
Professor Kamokoti, Director, Madras IIT, Mr. Boskey, Mr. Maadhu Balaji, my colleague and good friend, Professor Edwin Fernando from the Stanley Medical College, dignitaries, friends. Pardon me if my lecture is a repetition. But our mantra is like that. We have to repeat it. What is our mantra? Prevention, prevention, prevention. We have calculated that if a person gets a kidney failure, in his lifetime, he lands up on dialysis or transplantation. He or his organization ends up in spending almost 30 lakhs. Not to forget the hardships that the family undergoes and the suffering that the patient has. So prevention is extremely important. I think it can be repeated any number of times, and we have the expert, Dr. Edwin Fernando, to talk about it a little later. When I talk of repetition, I'm always remember Crazy Mohan. Crazy Mohan has been an ambassador for us for several years. So he narrated this episode once. He said they were touring down cities in the Chennai, in the Tamil Nadu, Coimbatore, Madurai, whatever, several cities. And after 4 or 5 cities, one man from the audience got up and he asked, "Enna sir, ella vaati ore joke crack pandringa." So Crazy Mohan said, "Nee yempa na pora edukala vara." So if you are going to attend my class, or rather my lecture, you are going to hear about prevention. There is no choice. Of course, I make a colorful presentation, at least the slides colorful, so that you will not sleep. Actually, I will narrate my experience. In 1984, a famous professor was taking a class on kidney disease. So in those days, I am sure many of you would know, it was a projector where you had to take out the slide, put it in and push it. So I was the projectionist. And this man used to say, it was in the afternoon, 2:30, after lunch, imagine. And this man was telling next, halfway through the lecture. No next is coming. So they switched on the light and they found that I was fast asleep. So that is the time I learned, knowing about kidney disease makes you very sleepy. Yeah, we started this foundation in 1997. A patient of mine actually gave me 3 lakhs and she asked me, why don't you help patients with this kidney disease? So this was an idea given to me by a patient in 1997. So we started first helping patients for dialysis. In those days, the cost of dialysis only 400 to 450 rupees. So we used to give a discount of 50 rupees, maximum 100 rupees with a struggle, but 50 rupees for dialysis, and it made a great difference in those days. So that's how we started, first to help patients with kidney disease. So in 1999, we got our first recognition. This is Rashida Bhagat, who wrote in the Indian Express that we have formed a trust of, by and for the patients. So the donations were received from my patients. The foundation is run by my own patients. We have Ramachandran and Kannan here who have crossed 30 years after transplantation, and they do the daily work of the foundation. They take care of the patients. And of course, the trust aim is to help again patients. So then, obviously, as early as in 2003, we realized that helping patients is only a minuscule. So what is more important is to prevent the disease. So prevention has to have a greater role. As I said, if you are going to spend 30 lakhs if you get a kidney disease, even if I prevent one person from landing up on dialysis, it's worthwhile. And if you do sensitive tests, almost 10% of the adult population in India will have an impaired kidney function. Imagine it. So a small percentage of this lands up on dialysis. Again, it's a huge burden on the country as well as on the society. So we started on this prevention classes. I used to go to any organization that would invite me and give these classes on, lectures on prevention. This is in the Raj Bhavan. The Honorable Governor at that time, he was the most attentive person in the audience, he asked me the maximum number of questions that day. Of course, the world leaders in prevention in kidney disease are Japanese. So in Japan, they have a very interesting program. Every year, every school child has to get the urine tested. This is an amazing program. It's compulsory, mandatory. So if you test the urine for either protein leak or presence of RBCs, what we call, you can pick up early a kidney disease. And this way, they have been able to bring down kidney failure in youngsters. So this is a program going on in Japan for several years in the world. So we got both Professor Toma and Tanabe with us. On the left side to you is Professor Toma. He was the chairman of the Tokyo Women's Medical College. This is a 2,000 bedded medical college in Shinjuku in Tokyo. Very, very busy area. And the other side is Professor Tanabe. He is a very famous transplant surgeon who is well known in the world for transplants across blood groups, whose technology we follow. So Tanabe now is the chairman of the Tokyo Medical College, and he has been in touch with us throughout, and we have been conducting the study in and around Chennai. So we go to colleges, we give the lecture, test the sample for urine examination. Of course, this is a program we launched in 2009. This is Andrew Simpkins, who is the Consul General of the USA, and Enram of the Hindu. And this is the early disease program. What we launched was that you should not only detect, you should also treat it and follow up. That is also important. Not just detecting alone and leaving it at that is gone. I am sure some of you would have heard of Dr. N.K. Mani, who is my teacher. His program, the Kidney Trust program, which he went around in and around the villages near Sriperumbudur, and they used to pick up diabetes, blood pressure, and give simple medicines and follow up them up for several years. This way he showed that kidney failure can be brought down. So this is an early disease program which we launched in 2009. The same year, of course, we launched our website. Obviously, internet is now I am talking in 2009 itself. So unless you are in the media, it won't reach a large number of people. So we started a website called sugarbp.org. All of you know that. I ask my patient, do you have diabetes? He will say no. I ask him, you have sugar? Yes, sir. So in India, we know like that. Same way, if I tell him, do you have hypertension? He will say, no, sir. What is this? BP? Yes. So our website is sugarbp.org. So it gives simple tips. The two leading causes of kidney disease is diabetes and hypertension. Hypertension also, both of them are silent killers. Hypertension especially is a silent killer. Even diabetes at least will manifest early. Diabetes in the absence of hypertension is not a great killer, but the combination is a great killer. So we launched the website sugarbp.org. You can go into it. It is in English, Tamil as well as in Hindi. And the maximum hits are from Sri Lanka and Malaysia, not from India. We get maximum hits from there. They look into the Tamil website and read about it. Of course, the International Society of Nephrology president visited us in 2010. And that time we had a very interesting project. We had a meeting, I think, right in the same place. And this is a big problem in this country. I'm sure all over the world, but in this country. What happens when a patient goes, the tests are done in different labs and they are different. So what happens is the doctor makes you repeat in a particular different lab. So patients get very upset. They say, I've just done the test and this man wants to repeat it. This is a big problem in our country. There is no standardization of laboratory tests. And for diagnosing kidney disease, we are entirely dependent on the laboratory. A simple test like serum creatinine has to be reliable, and this is not standardized. You will be shocked. There are people who will have a normal range of 1 to 2, whereas some people will have a normal range of 0.5 to 1. You can see the difference. It can be enormous. 1.5 could mean a kidney failure, whereas in one lab it can be normal. So standardization of serum creatinine is very challenging in this country to do this, and we raised this issue in 2010. Of course, the salt satyagraha. Our satyagraha is different. As I said, one of the biggest killer, according to me, salt is a slow poison. You never know how it kills you. Over years, slowly produces complications. You are not aware of it. It's like the king dying out of the arsenic. You must have heard in those days the queen used to poison the king by giving small doses of arsenic. So you will never know. The king gets few diarrhea, loose motions, and one fine day he is not there. So it's like that. Salt, if you go on taking in excess quantity, one fine day you are not there. You have a stroke, or you have a heart attack, or you have a kidney failure. So this is our passionate program since 2010. We have been doing it all over the country, trying to lower the salt intake of the population. This is a walkathon which was done, you can see Crazy Mohan and Andrew Simpkins on the Marina Beach. This was in Pondicherry. Our colleagues have always been helpful. Today Edwin Fernando has come. We have several people in Tamil Nadu who have always been receptive for our programs. This is a program that was done in Pondicherry. There was one similar one in Trichy. And of course, this is a very interesting concept. Every year, we have been celebrating from 2010 the World Kidney Day. The theme, again, whatever may be, ultimately boils down, as I said, to prevention. And in 2011, we had, this is in the Satyam Theatre complex, what we did was, we were distributing urine dipstick. So you have a small strip of paper, you put it in the urine, and you can see whether there is a protein loss or a sugar loss. So this is like the pregnancy test. You have the pregnancy test which you can do on the counter. So this is for the urine albumin. So this we have been using in colleges very successfully. We have published our data in international journals. So we go to colleges, give them the strips, make the students test for it, and we found that surprisingly about 4% of the student population have abnormality in urine protein excretion. The first marker of a kidney disease is presence of protein in the urine, not the blood test. So you should get alerted. When you see protein in the urine, it is required to be attended to. Of course, a rare disease called cystinosis. So this is a foundation which we launched chapter in 2012. You can see the child the mother is carrying. You won't believe the child is 12 years of age. Can you believe? The child is not grown at all. All these are very elderly people. Actually, the children that you are seeing down are also quite old, but you see them so growth retarded. So this is a rare disease. It's called an orphan disease, where the cystine crystals gets deposited in various organs, and when it gets deposited in the kidney, it leads to a kidney failure. So I accidentally stumbled upon this in 2012, and we started this foundation, and we are the 11th foundation in the world, and we have now 40 patients, children registered with us, and we help them with regards to getting the medicine from abroad, which costs us about 2 to 3 lakhs a year, and we have also helped them for kidney transplantation. Of course, Superstar was kind enough to launch the chapter. So every year we do get celebrities, so all of you can be happy that you are celebrities for this year. So this is Arun Swami for the acute kidney injury. Many of you know. So always patients nowadays are better. They are aware. Will my kidney failure improve? Somebody comes to me, and this is often a question asked to me. Patient comes on dialysis. The first question they want to know, can I stop dialysis? Can I come out of this? So that's possible only if you have an acute kidney injury. That means your kidneys have been normal today, and for some reason it has got deranged. In a couple of days, a couple of weeks, we can rectify it back to normal. So that's called acute kidney injury. Whereas many of them are in what is called chronic kidney disease. And over years, slowly the kidney gets damaged and becomes small. That cannot be rectified. So we created an awareness on acute kidney injury. Every year we make documentaries also. I think our film director Rajan is here. He's sitting here. Rajan, up. We should give a big hand. He has made several documentaries for us. You should look into the website. Please put our Sapiens Health Foundation and documentary. You will see wonderful documentaries that Rajan has made. This is on aging. This is a very popular talk wherever I go, because usually the audience that I get are elderly people. The maximum audience, of course, Sundar would agree with me, I had it was in tax center when we had almost 300 people. But the average age of the person was about 70. So the kidneys, the aging changes. Aging reduces the kidney function. So what tips? How do you take care of your kidney as you grow old? Should you reduce the salt? Should you increase the potassium? Should you increase your water intake? What are the pointers that you should be scared of? This is on the World Kidney Day 2014. We elaborated on kidneys and aging. A small joke here again. Somebody asked me, diet is very important in kidney disease. For that matter of fact, in any disease. Arun would agree with me. So this man, So if somebody above 70 asks me what diet to eat, I tell them maybe a bit restriction, etc. Somebody above 80 asks me what can I restrict, I say no need to restrict anything. You can eat what you want. And somebody above 90 asks me what to do. I tell him, please tell me what you are doing, I can tell you. The PD Assist program, this is very unique in the world. See, you must have heard of people all helping hemodialysis. You have Rotary clubs, Lions clubs. Patients come to me, I've got well said, I want to donate a couple of dialysis machines, please run it. We want to get rid of this hemodialysis business. We want people to have treatment at home. Peritoneal dialysis, have your dialysis at home. Do it in the night, go for your work. 7 days a week, you can work and take care of yourself. You be a breadwinner. You don't have to come to the hospital. This is called peritoneal dialysis. So we have an assist program. We are the only people who help for peritoneal dialysis patients. We have all over the country where we subsidize that peritoneal. Of course, this kit you should see. Jiva is here. Where is Jiva? Jiva of Telangana. He has made this kit. It's a humorous play. I'm sure Maadhu Balaji will agree. He did hear that in the same menu. I think we had it in Anna in Sarai only. And this is a Tamil play. And it is very humorous, where we have been taking this kit, 45 minutes kit, we go to the slums, we put it there, we create an awareness about mainly salt, blood pressure and few health tips for them. And it is amazingly successful. He has done not only in Chennai, outside Chennai also. Please Google this, Tamil play, Sapiens Health Foundation, you can laugh for 45 minutes. Of course, this is the World Kidney Day on children. Again, children have certain specific diseases, like they have defects from birth. So the urine, instead of going down because of a defect in the valve, goes back to the kidney. So it damages kidney. So children have different reasons for kidney disease. How do we handle it? So we had a World Kidney Day on diseases in children. Of course, obesity. People don't understand. Overweight increases the load on the kidney. It can increase the protein leak in the urine. So people have to be aware of obesity, and in India, one of the biggest problems is not just obesity, what is called truncal obesity. They are thin in the arms, but they have a big paunch. This is a very tricky problem. This, I always, I don't know whether you know, Apollo, I should mention that, long back, they had to give a big advertisement, 64 CT, you want to know whether you get a heart attack or 64 CT, blah, 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 advertisement. I said just have a measuring tape. Measure waist to hip ratio. If your waist is bigger than the hip, you know you will get heart attack. You don't require a CT scan to tell you that you will get a heart attack. So obesity is a very important cause of morbidity. Of course, our salt fight. As I said, we are very passionate about salt. We had an international conference. Professor Graham McGregor from the UK, he's the founder of the WASH group. Soumya Swaminathan from the WHO and IIT people. This was a conference held in IIT Madras and IIT Mumbai, jointly with them, trying to create an awareness about salt intake. Again, a small joke on the salt. WHO says you have to take only 5 grams of salt per day. So a patient asked me, how do you know 5 grams of salt? I said, 1 teaspoon of salt, that's considered 5 grams for the whole day. That fellow, what he did, he goes home and he eats everything, in addition he takes that 5 grams. So you have to be very careful in India, explaining to them that the salt is from all sources, not just extra 5 grams. We do have, you must have seen, all these sort of, you will see the next one. Yeah, this is again women's health. We had on, women have special reason to get kidney disease, apart from gender bias. You know that in India, one of the reasons for women suffering more is the gender bias. The women may not get treated in the poor. The man has the priority for treatment, whereas the woman may not have. Her health is ignored. Often I have patients where they come to dialysis. The poor husband is on dialysis for years. One fine day the wife is gone. Not the husband. He's still coming for dialysis. They have sold everything and taking care of only of the husband. The husband is still there, wife is gone. So that's the problem. So women have certain special reasons to have kidney disease. Of course, this was a New Year resolution, which again was implemented in this restaurant also. One of the things you must have noted, somebody orders for a soup. The first thing, they just stop and then they see a salt shaker, they add salt, they add pepper, and then they eat. They never even taste it first and see whether there is a salt or not. So we said that every restaurant, you should not keep a salt shaker. All the restaurants in Chennai, we called them, we went and met them, we said you should not keep. If a patient asks for a poison, if a person asks for his poison, you give it. But don't keep it on the table. So this was the resolution. I know, crazy one used to always say, Uppilla Patam, Kupaile. Uppilla Patam, no, Uppilla Patam, Kupaile, Uppilla Patam, Topaile. Yeah, correct. We have salt essay competition. Children are the best. See, I talked to you today. See, I was telling you about the repetition. It doesn't matter in this crowd because as you grow old, there is a big talk I can give on a memory. You forget things. It's called transients. What I talk today, you will forget tomorrow. It goes on, evaporates so fast. But what we talk among school children or college students, they remember for life. That's why we target college and school children. We hold an essay competition on salt. This is the function we had where we gave awards for several students for writing essays on you. You should have seen the amazing work that they can do. Of course, this is a very interesting. Maadhu is there. We had K.S. Ravikumar. I think this is in 2020. We launched the low salt snack with Papadocs. Papadocs, they have it in the UK. All over the world, you have low salt snacks. In India, we don't have. This is again a big talk. We don't have labeling of salt very clearly, and low salt snacks are not available. Substitute is not available for you. If you want to eat a chips, you have only one type of chips available for you. You are not given the choice of a low salt chip. If you want to eat bread, you are not given the choice of a low salt bread. All over the world, there is a preferred this thing available. Of course, living well with kidney disease, last year we showed so many patients who manage their life very well in spite of dialysis, transplant, whatever it is. I'm very proud to mention this. We got the award for the notable achievement in the world by the World Hypertension League for bringing down the salt intake in the country. And not only that, we were first. You could see it is in about 12 countries, we were the leading for producing reduction in salt intake in the country. Yeah, I think already I have exceeded probably my time, but briefly, looking the future, patients always ask me, okay sir, you talk about prevention, what is in there for us? This is always a question. This is where I think it's very apt that Professor Kamokoti is here with us from the Premier Institution of Research, and he was just asking me what to talk. I said, you should talk about research. What makes the difference for a patient who has already a problem is research. What are the newer developments that can happen? What technology can offer better to them? The future depends on what we do at present, Mahatma Gandhi. Yeah, so artificial intelligence. I'm sure all of you know about it. The moment you put your Google, you put something, if you have yesterday search for a dhoti, today it will show what are the dhotis available in the market. Whether you want or not. That is artificial intelligence or machine learning. So it can analyze large amount of data which no human being can do, and then it can guide you. Apps are being developed for various diseases, kidney diseases. So it helps. It cannot replace the nephrologist, but it definitely helps. It can make the treatment more uniform. See, right now people come from different places saying that I have confidence only in this doctor. Yes. I'm sure that is useful, but still, you should make the treatment uniform all over the country. So artificial intelligence, I think, is a step for that. Again, it can help in kidney tumors to make out, this is cancer, not cancer. This is a kidney disease which will recover, not recover. How can I improve my quality of life on dialysis? How can I improve my longevity on dialysis? What about kidney transplantation? Am I a candidate for it? What am I in for it? How long will I live out of it? All these things, answers, come through artificial intelligence. That's where we have, as I said, Professor Kamokoti, the research in this group, the interaction between the medical and the engineering profession, which has been lacking in India, but now it is growing. He would, I'm sure, mention it. Artificial kidney. Everybody asks me, sir, I don't have a donor. Where is the artificial kidney? So this is a common question. Unfortunately, we don't have an answer. I can only show him a slide that you can put it into your body or wear it. But it's still not on the practical. This is a bio kidney which has high flux membranes as well as certain cells. So it does the work of the kidney. But still, it is all in research. Patients have lived only for a short time, or animals have been living on it. Not on a practical basis. It's implanted, the artery it takes off, the vein it takes off into the bladder. So you pass urine normally, it is implanted into you. This is a wearable one. You don't require water. So this is a dialysis kit. You just wear it and you can travel where you want, still your dialysis goes on. So this is a wearable one. You can travel, you can have your picnic, you can do what you want. This is the peritoneal dialysis again, which is wearable. So stem cell, everybody, this was a craze. Sometime back, if you had seen, the patient would be aware. Because a lot of fellows were trying to inject anything into tissues and then claiming success. Unfortunately, in our country, there are a lot of success claims which are all forms. So patients, there is so much importance given to the press, and everybody was aware of this stem cell. So they wanted to know, what is a stem cell? It's a basic cell which can differentiate into different tissues or organs. So if I put this cell into you, it will differentiate into a kidney cell or a nephron. If I put into this, in bone marrow disease, this has been very useful. In kidney disease, it has not been very useful. Parkinson's, yes. Certain neurological diseases, the research is very intense. But in kidney disease, it has been very transient. This is again a very interesting topic. If you are taken in 1990 when I attended a conference in Europe, the biggest talk, the poster was, which is your animal that you will choose? So you have kidney failure, you want a transplant, please choose the animal, like a menu card. You can take a kidney from that animal and put it away. So that's called Xeno Transplantation. Xeno transplant is very difficult because you have to genetically modify the animal. Otherwise it will get rejected on table. And secondly, you can transmit diseases which are rare. So it's not a common thing, but pigs are used, genetically modified pigs, and as you know well, in brain dead people, kidney transplants have been done from the pig, but they have all lived, the longest longevity has been 5 days, and of course, you must have seen this David Bennett who received a pig heart on January 7th. Unfortunately, day before yesterday he died. So he lived for 2.5 months, around that. This is the longest survival that is reported. This was about 1 month after his transplantation, when the pig kidney was given to him. So choose your animal, maybe in the future. I will end my lecture with a disclaimer. Now I have learned this new word in Tamil, responsible for my talk. Thank you.